Hi, everyone. I am Dr. Mary Alvarez. I'm glad to be here to speak today on the clinical importance of including the favored parent in reunification work or alienation work. So, just a brief summary about me. I am a psychologist in Austin, Texas, former custody evaluator. I have approximately 20 years in family law matters. Currently, I conduct psychological evaluations. I work with high conflict families, parental alienation cases, and I do quite a bit of reunification work. So, my presentation today is going to focus on mild alienation. This is a case when the child resists somewhat spending time with the target parent, but once he or she is with the target parent, they settle in, they have a good time. The relationship looks mostly normal. However, under mild conditions, the child begins to tell the favored parent when he or she returns home what that favored parent wants to hear about the target parent. And then the child is beginning to feel the stress and pressure of the alienation tactics that the favored parent is using. So that's a brief summary of mild alienation. And my presentation also applies to moderate alienation. Now, this is a situation in which the child is much more resistant to spending time with the parent. And when they are with the target parent, they tend to isolate, stay in the room the majority of the time, withdraw from the family. And this child makes the same complaints as the favored parent. So we're starting to see that enmeshment. And then the child begins to lose what we call critical thinking skills and their ability to make decisions and make inferences based on their own experiences with the target parent, not influenced by the favored parent. So they lose that ability to construct their own reality. So as I move into including the favored parent in treatment, let's go through a brief research review because this sets the stage for why it is that we do what we do and why I advocate under mild and moderate conditions of alienation to include the favored parent. So briefly, let's talk about children's responses to high conflict divorce or outcomes for children when they're involved in a high conflict divorce. So we know that about 65% of these kids develop an anxiety disorder, significant enough to require attention or counseling. A little bit more than half develop an attachment disorder. So there's a disruption in the attachment between the child and a parent figure. Almost half of these children have abnormal fears or phobias. So we can see the elevations in toxic stress, for example. 44% act out their stress, and approximately a third of children start to experience sleep disorders. So that starts to affect their biological systems in ways that make it harder for them to function in life, in school, socially, etc. So let's look at previously alienated children as adults. And this is a new 2022 study out of Australia. And what they found is that when alienated children grow up, more than half of them experience depression and anxiety. 20% of them have body image or body dysmorphia. Personality problems occur in 40% of the now adults who are alienated as children. What else did this study find? A third of the now adults experienced suicidal ideation or thinking about suicide. 15% engaged in self-harm behaviors, and 10% had psychosomatic diagnoses, which is many physical symptoms without any physical basis for the symptoms that they experience. Additionally, in now adults, 55% of the now adults started drinking in adolescence. They started consuming alcohol as a way to cope. Marijuana use occurred in about a third of the adults, and sex or pornography use occurred, or addictions occurred in about 10% of that population. These adults also experience shame and guilt. They have difficulties with self-worth, self-esteem, self-confidence, and 30% felt lonely and isolated as adults. Helplessness, 20%. Grief and loss experienced by the adults, 60%. They have had a history of disrupted relationships, lost relationships, that's grief and loss. And then almost half of these individuals experienced anger, which is internal and related to depression. And finally, about 15% of these now adults experienced abandonment issues, and that will play out in their adult relationships, friendships with colleagues, for example. And half of these now adults who were alienated as children have poor maladaptive coping skills. So their ability to function as an adult is significantly compromised. So these children, when they grow up, don't shake off, for example, the effects of being alienated from one parent. And an additional study that was from Amy Baker in 2012, again, looking at now adults who were previously alienated, she found that 70% experienced depression, and the baseline rate in our country, the United States, is 8% of adults would meet the clinical criteria for depression. 65% had decreased self-worth, which is consistent with the previous research that I presented to you. 50% are alienated from their own children. So there's a multi-generational effect. So as parents, they struggle to provide the nurturing environment that kids need because of their own very chaotic and disruptive environment that they experienced. 40% have trust issues. And the final sobering statistic from this research, 35% of now adults struggled with addictions. And in our country, 10% of the population of adults would struggle with addictions. And so you can see the depression and the addictions are at much higher rates in previously alienated children who are adults than adults in our country who were not alienated as children. So that is just a brief background as to why this work is so important and why preventing and intervening early is very important. And in my presentation, including the favored parent is part of that whole process. So before I slide into exactly what I mean by including the favored parent in treatment, let me just review a little bit about toxic stress, because that's what happens to children. But I hear questions sometimes that say, is all stress bad? And the answer is no. But under conditions of high conflict families and parental alienation, yes. So on the left-hand side, what we find in these families, the high conflict families, is the stress is unpredictable, it's extreme, it's prolonged. And if that is the case, then the child becomes sensitized and vulnerable to the effects of toxic stress on the brain. However, if stress is predictable, moderate, and controllable, meaning we have some ability to make a difference in the stress to reduce it, then the individual develops tolerance and resilience. So no, not all stress is bad, but under conditions of parental alienation, it can develop into what we call toxic stress. So what about the brain and serotonin? Because this is one of the effects of toxic stress and childhood trauma, which we consider parental alienation to be a form of child abuse. Serotonin is involved in mood and mood regulation. And childhood trauma dysregulates serotonin, which it helps explain the increased rates of depression, for example, in the adults who were previously alienated as children. And decreased serotonin is related to not only depression, but anxiety, aggression, and certain personality disorders. So just another example of why it's so important that we strive to make a difference with these families as quickly as we can. The last neurochemical I'm going to talk about is oxytocin and trauma. So oxytocin is involved in interpersonal relationships, interpersonal interactions. It is involved in several cognitive functions, such as social memory, emotional recognition, empathy, and attachment. which are very important factors in childhood. It's involved in the regulation of stress. And finally, decreased levels of oxytocin have been found in adults who had abuse histories, especially emotional abuse. And again, by definition, parental alienation is a form of emotional abuse. And so the effects on the child's brain are observable and evident into adulthood with respect to oxytocin. So, consequences of toxic stress from a psychological perspective. Toxic stress predicts PTSD, depression, anxiety, antisocial behavior, and it predicts a greater risk for alcohol and drug disorders or addictions. Childhood traumas that are interpersonal, which is the parent-child relationship, and chronic, which can be parental alienation, are particularly associated with the psychological consequences that I just mentioned, as well as the neurological consequences that I'm going to present to you next. So these are deficits neurologically that have been found as a result of toxic stress. Essentially, many of the processing areas are affected, such as memory and learning, executive functions, which are functions in the frontal lobe, which is the area of the brain right below your forehead. IQ and academic performance is affected, and children don't reach their full potential. Language processing, receptive, expressive, written language are affected, as well as visual spatial skills. And then what DeBellis and Zisk found were some anatomical differences in the brain. So anatomically, they found a smaller prefrontal cortex, which is a very important newer region of our brain for higher level processing, critical thinking skills, problem skills, and integrating a wide variety of information from other areas of the brain. They found less prefrontal white matter, and they found a smaller corpus callosum. And what that structure is, it lies deep in our brain, and it helps the left and right hemisphere communicate with each other and share information between each other, again, for more efficient processing. So these are all psychological and neurological deficits of toxic stress. So now let's get into the nuts and bolts of including the favored parent in treatment, all right? Set the stage with the research as to the things that we want to mitigate, the developmental consequences for children that we want to mitigate. And it's generally counterintuitive to include the favored parent. It's counterintuitive to professionals. It's counterintuitive to the judiciary. And why is that? Well, the favored parent appears to have a good relationship with the child. The child resists at some level a relationship with the target parent. And the favored parent claims to want the child and the other parent to have a solid, favorable relationship. And so those are three factors that are counterintuitive as to why would you want to include the favored parent. They seem to be doing fine with their relationship, and they're supportive of the relationship, or so they claim, with the other parent. All right. It's completely normal from a target parent perspective, however, to not want much, if anything, to do with the favored parent. Right? Remember, this is the parent who's on the receiving end of the disrupted relationship. It's normal to only want a solid relationship with the child and minimal contact with the favored parent. And as clinicians focus on the relationship between the rejected parent and the child because the other parent-child relationship appears to be just fine. And so as clinicians train to address and focus and create treatment plans for the problematic issues, going on. So these are reasons that it's counterintuitive, and these are reasons that the favored parent hasn't been, in my opinion, regularly included in the overall treatment approach. However, if you don't, as a clinician, or as a judge, order the participation of the favored parent in treatment. This is what ends up happening. This allows the favored parent to just sit on the sidelines and just be an observer, while concluding that he or she is not the problem because he or she is not involved in the overall treatment approach. And the favored parent just continues, the alienation tactics from the sidelines. And so this is my argument why you need to include, the favored parent in the overall approach. So what are some of the pros of including the favored parent, in this family work? Well, number one, the alienating parent must engage in the reunification process. They have to participate. They don't want to participate. They make it difficult to participate, but they must participate in order to be held accountable. The alienating parent's personal accountability, responsibility, culpability, all of those things need to be addressed as part of the alienation process. So just allowing the favored parent to sit on the sidelines and have unfettered access to the child with no changes in his or her behavior whatsoever just allows the alienation to continue to unfold. And then my third pro of including the favored parent in reunification work is a reduction, hopefully, that's the goal, in the use of alienation tactics. But does the favored parent really want the child and the other parent to have a developmentally healthy, positive parent-child relationship? Is that really true? Or are they just using lip service in order to satisfy the court, satisfy the clinician, etc.? Well, in my experience, anecdotally, maybe not. In my experience with a mildly alienated child, I found that mostly, yes, the favored parent really does genuinely want a relationship with the child and the other parent. This seems to be more of an educational issue than a psychopathological issue. But in the moderately alienated child, the answer is mostly no. These parents just give lip service to the court and the professionals that they want a parent-child relationship with the target parent, but their behavior indicates otherwise, and they continue to be disruptive during the process, which we will talk about. So one of the concepts that underscores why the favored parents can be so difficult to work with and manage as part of these alienation reunification situations is because of personality disorders, or what we call many of the high conflict personality traits. And so high conflict personalities, which I'm going to define, plus high conflict parenting equals, at least some of the time, parental alienation. And so there's really a personality-based factor, involved that leads to, in certain instances, parental alienation. So let's talk about some of the clinical considerations and clinical challenges in working with a parent who has either a full-blown personality disorder or at least many of the traits of a particular personality disorder. So clinical challenge number one is simply the fact that the parent has these either traits or a full-blown personality disorder. That's difficult under normal situations. If you're a clinician and you have a patient who has one of the high conflict personality disorders, they are a challenge. They are a challenge to work with. They are a challenge to help this person make progress as a function of what they're dealing with. So there are 4 high conflict personalities. All right. The first one is what we call antisocial personality. All right. The second one is what we call borderline personality or borderline personality disorder. The third one is histrionic personality. Finally, we have the narcissistic personality. And so I'm going to go through all four of these, because these are the four under the DSM-5 that we consider high conflict. And they have high conflict in multiple areas of their life, not just in a marriage. So let's take a look at the core traits of an antisocial personality. So this is an individual who disregards laws and rules. Laws apply to other people, rules apply to other people. They don't apply to me or in the same way. They engage in life, they engage with others with deceit, lying. They exploit others for their own personal gain, for their own personal advancement. They're arrogant, intimidating, hostile when they interact with other people, very off-putting, very unpleasant people to deal with. They're abusive, aggressive. They have rage episodes, again, much more than the normal adult in our country, our population. They show little to no empathy or remorse for their behavior, their effect on other people, the fact that they exploited somebody and benefited from it. That's just par for the course for antisocial personalities. And finally, they're irresponsible. They have legal problems. Again, laws and rules don't apply to them. And so when they engage in behavior that's illegal, for example, the legal system attempts to bring them, to accountability. And so they have legal problems as a result of that. That is the antisocial personality. So let's look at the core traits of a borderline. Borderlines present as very emotionally unstable. Their emotions move from one end of the spectrum to the other unpredictably, intensely, and unstably. They tend to have a history of or current behaviors that we consider self-harm. That could be suicidal attempts, and that could also be cutting, self-harm with a razor blade, for example. Their emotions are very intense given the situation, far exceeds what should be the emotional reaction in any given situation. They almost always have abandonment issues. If you look backwards at their early history, there are examples of prolonged abandonment. They have detached parents, detached mother, the primary caregiver, for example. And then as a result of all of their early childhood mishaps, they have an unstable sense of their self. They really don't have an identity. And so a borderline tends to morph into like a chameleon, whatever the situation requires of them, instead of having a stable sense of yourself that you carry from situation to situation. Their sense of self just changes depending on who they're with, what the expectations are, etc. So that is a borderline. Again, it's a high conflict personality. So histrionic. I personally don't see a lot of histrionics as related to parental alienation, but upon occasion, yes. They are the very dramatic person in the room. Very dramatic. Actor, actress style theatrics. They are emotionally erratic. So it's very difficult to predict how this person is going to react. Sometimes they react within social norms. Much of the time they don't. And they just seem very off and out of touch with the current context and what emotions they should be exhibiting. They also are the person in the room that craves the center of attention role. They want to be the center of attention. They engage in behaviors that make them the center of attention, and not always positively. But that's the person who needs constant recognition and all eyes on him or her. And they also tend to be seductive and provocative. And that does play itself out in certain parent-child relationships. And I'll explain that as we move along. So that's that person in the room. Finally, let's look at the core features of narcissism. And I think as a society, we are using narcissism on a really regular basis to describe people. And I'm not saying that that's erroneous, but it seems to be a term that we are casually using. So let's take a look at it. Narcissists feel entitled. All right, they feel special and unique, and they are entitled to special consideration and special everything. They are conflict oriented. And so when there's no conflict, a narcissist will create conflict. It's almost like a fuel, for them. They have little to no insight. And so approaching a narcissist with an insight-oriented therapeutic approach is largely going to be ineffective because they have little to no ability to look inward and gain information that will be useful in making behavioral changes. Like the antisocial personality, they also exploit others and situations for their own personal gain, and they require much adulation, praise, attaboy kinds of things. They, again, use that like a fuel. And so when they don't receive what they believe is sufficient praise and adulation, they sustain what we call a narcissistic injury, in which they are emotionally devastated and wounded, by the fact that those around them are not giving them deserved recognition in life. And then once you have an injury, a narcissistic injury or wound, then the narcissist creates conflict, they exploit others, they become angry, and very, very unpleasant people to deal with. So why are these 4 personalities challenge number 1? Because what they all have in common are they're disruptive to relationships, whether it's parent-child relationship, husband-wife relationship, neighbor-neighbor relationship, colleague-colleague relationship. They are disruptive. They are manipulative. Now, they have different goals and objectives, as far as using their manipulation, but that's what they do. They like to manipulate people to achieve whatever it is they want to achieve. They are what we call obstructionists. They create obstructions. They create ways for life to be difficult. They create roadblocks in situations and interactions and relationships. And they're conflict oriented. All 4 of those personality disorders, antisocial, borderline, histrionic, and narcissistic, are all conflict oriented. So that's why they are a challenge for clinicians. All right, let's take a look at, and bring this back down to parental alienation. Let's take a look at a favored parent with an antisocial personality, or, the full-blown antisocial personality disorder. What do they look like as a parent? Well, first of all, rules don't apply to the favored parent, and they're very hypocritical. So, for example, orders written by the court are not followed by the antisocial person because they don't apply. They apply to the other parent or any other parent except for that person. This person threatens to take the kids and you'll never see them again. For example, that's just one of the behaviors, that they use. That's the intimidation. That's the aggression. That's part of what we call intimate partner violence. They use rage to control and intimidate. So again, they exude the kinds of very off-putting and scary behaviors that most people recoil from. And they use that in ways to control the environment, to control their agenda, whatever that is. And if their agenda is to disrupt or ruin the relationship between the child or children and the other parent, then they will be intimidating and controlling and use threats. So that is a glimpse into an antisocial personality as a favored parent. What about the favored parent who has borderline personality traits or disorder? So that's a parent who has rapidly shifting moods. It's very difficult to be married to that person, and it's very difficult to try and co-parent or even parallel parent, with that individual. This kind of parent is difficult for children because they can't predict how the parent is going to be on any given day or in any given situation within a day. These are the people that others describe that they have to walk on eggshells around because they never know what to expect and there's no predictability. This person tends to cling to the children. All right. They have abandonment issues. And so they use the children as a way to try and cope with this just bottomless feeling of emptiness. They also have what we call emotional wounds. And if they are emotionally wounded, again, they will act out, they will create conflict, they will engage in wildly swinging moods. And finally, using the children as weapons. Borderlines will use the children as weapons. They weaponize the kids against the other parent, for example. And so it's not really about the kids. It's about the kids being a tool for this parent to use to enact revenge, etc., on the target parent. If we happen to have a favored parent with a histrionic personality or personality disorder, what we have are the following. So let's start on the left-hand side. We have the actor-actress phenomena that I described earlier. And so how does that play out, with children, for example, sexually provocative with the child? I've had a few cases, not on a regular basis, in which the parent is sexually provocative, just completely and developmentally inappropriate. Having conversations with the child about sex, with their partner, or with the other parent when they were married, for example, making comments about the child and the child's growing sexuality in a way that's really uncomfortable. It's not an educational conversation. It's a provocative, conversation. It's also the parent, again, in the room who has to have all of the attention. And so this is the parent that embarrasses the child. This is the parent that on the soccer field creates a conflict, and then all eyes on that parent to the child's chagrin because it's embarrassing to have your parent act out. This parent makes allegations. Now, of course, all of the other personality disorders can make allegations as well, but let's talk about this within the context of histrionic. The allegations are outrageous, against the target parent. I mean, almost unable to really happen in the real world, kinds of allegations. Sexual abuse is a frequent flyer, driving drunk, things like that, with no facts, no basis, for making the allegations. And this personality type uses guilt and drama to control not only the target parent, but the target parent and child's relationship. So guilt and drama. And so the relationship, again, is obstructed because the target parent and the child have to constantly wade through, all of these types of personality traits that make it really hard to just have a relationship. You have to get past the guilt. You have to deal with the guilt. You have to deal with the drama, that occurs at the front door, during an exchange, for example. So that is what a favorite parent with a histrionic personality could look like. And finally, let's look at a favorite parent with narcissism. And this, for me, is a frequent flyer. I would say that the borderline personality and the narcissistic personality are two of the most frequent personalities that I see in favorite parents, in which alienation is a factor. So the narcissist demands loyalty, not just asks for loyalty, but demands loyalty from the child. I mean, it is explicit. It's not just some subtle undercurrent in that favorite parent-child relationship. Very obvious. The narcissist constantly blames the target parent for everything. The narcissist takes no responsibility for his or her behavior. Everything is attributed to the target parent while being hypocritical, because the favored parent engages in many maladaptive behaviors and interferes in the relationship with the child and the other parent. But again, blames the target parent for anything that the narcissistic parent does. It's just a reaction to what the target parent does. I had to, enact this rule or this consequence for the child because of the target parent. The narcissistic parent creates a fear in the child. That is one way to control, the child, is through fear. And I see that. And chronic fear in children is a precipitating factor for toxic stress when they cannot feel safe, in an environment that demands unilateral loyalty to the favored parent. And finally, the narcissistic parent will reward the child's rejection, sometimes very blatantly with, objects, things that they go out and buy, but more often with subtle to very obvious interaction rewards, like, I'm really glad that you put your foot down with your other parent because that parent was treating you, just so horribly and egregiously. I'm really glad that you did that, attaboy kind of a discussion with the child and the narcissistic parent. So let's talk about what I call clinical challenge number 2. So clinical challenge number 1 was having a parent with either one of the 4 high conflict personality disorders. And it follows that clinical challenge number 2 is, how do you manage the favored parent who has a personality disorder, or at least many of the traits of one of the 4 high conflict personality disorders? So that's part 2. You have a parent with a disorder, and now you've got to manage that person in the context of parental alienation reunification work. Again, let me just remind you, mild and moderate. So my backdrop for discussing further is a little bit more about the brain. So I want you to take a look at this. All right, it's just a very basic image of the brain with 3 basic areas of the brain that we're going to talk about, because the important concept that I want you to take away is that our brain, all of us, right? This is not just unique to the population of alienating parents. Our brain is organized to act and feel before we think. So thinking is the last thing that happens as information enters our brain. So if you take a look at this arrow on the right-hand side of the screen, at the bottom, it says simple functions. And that means simple functions are managed by the lower parts of the brain, the brainstem, okay, which is right above your neck, at the base of your skull. And then as information moves through the brain into the limbic system and the cortex, all right, which follows that arrow, information undergoes more complex functions and more higher level functions. All right, so you can see that information entering the brainstem is very rudimentary. It moves to the limbic system, which is the emotional center, and hopefully it moves on to the cortex where people can think about it. But in families with parental alienation, and especially when there is one of the 4 high conflict personality disorders, information is bottlenecked in the limbic system. All right. And so when you're dealing with somebody who is acting out, raging, has unstable and erratic emotions, their ability to think and process information is offline. And I think this is really, really important for, everybody to understand, because we tend to want to use language and higher level thinking and examples and logic and analytics, to deal with parents who are considered favored parents. But a lot of their processing stalls in the limbic system, and it's just surrounded by emotional aspects and not the thinking aspects. And so as a clinician, recognizing this and using this information in your work with a favored parent, which I'm going to describe in detail and tell you as clinicians what are the most successful ways to deal with a favored parent with a high conflict personality, because they get stuck in the limbic system, the feeling system, and they don't move regularly into their thinking system. So just a reminder that high conflict personalities involve disruptiveness, manipulation, obstruction, and they are triggers for the target parent. So the same kinds of behaviors that the target parent dealt with in the relationship or the marriage became triggers, and they're still triggers post-relationship or post-divorce. And so I mention that because it's a factor in the way that you undergo reunification. So the clinician's challenge number 2 involves these topics that include the favored parent's involvement. So these are some of the nuts and bolts of dealing with a favored parent in reunification for mild or moderately alienated children. First, there has to be a moratorium on history. It serves no purpose whatsoever to go backwards in time and try and unravel, unpack historical situations, historical events. For example, in fact, you are just providing the high conflict parent with an arsenal of weapons to use. And it's difficult for the clinician to get out of this once you go into the history. You have to be very, very careful that it is now forward. Working with parents, obviously, in reunification is always child-focused. So, for example, if as a clinician you recognize that one or both parents, and it's usually both, would benefit from some individual therapy, then make that referral, because it's important for the parents to address their own individual needs or psychopathology, but the reunification process is child-focused. It's not parent-focused. Forward progress emphasis. As I mentioned with moratorium on history, it is about moving forward, making changes to move forward, not going backwards and trying to rectify past problems or past emotional injuries or wounds. We include education of both parents. In my work, I include education of both parents about the very same things that I presented earlier in this presentation to you, about the science and research, outcome studies, developmental outcome studies, psychological, neuropsychological outcome studies. We also look at parallel versus co-parenting. While co-parenting might be the goal, for parents, a lot of parents embroiled in high conflict divorces need to use parallel parenting. And I'll describe that a little bit more. So diving into co-parenting can be disastrous because it sets up the target parent for just repeated abuses, from the favored parent. Basic parenting skills, such as communication, triggers, and creating a new family model are part of what a clinician must achieve, in these reunification families. Even with parallel parenting, you have to have a form of communication. Now, it might be Our Family Wizard. There might be some other parent platform where they communicate online and in writing, but you have to have some way for parents to communicate, for example. You also want to try and achieve a better balance of power because of the power differential that we find with these high conflict parents and how they hijack the family and the other parent with their emotions, with their unstable and highly intense emotions. Creating a better balance of power is important. It's difficult, but it's important. And then holding the alienating parent or the favored parent accountable. That is also one of the objectives of a clinician, because they have managed to skirt by or avoid or sideswipe much accountability. That's part of their manipulation. So I have 3 of those 8 areas that I'm going to go into in a little bit more detail because I think they're worth a little bit more detail. The moratorium on history. Just can't underscore that enough. Very limited to no discussion about the past. All right. Yes, there is a past. Yes, you need to understand it as a clinician, but it is going to torpedo any progress forward if you go backwards first. Don't talk about feelings as related to the past. This is directly related to favored parents and high conflict personalities getting stuck in the limbic system, the emotional centers of the brain, and not the cognitive centers. And so you don't want to create a way for these parents to stay stuck in the limbic system. So we don't talk about feelings, all right? And we redirect these parents back to the current or the future. When they go backwards and they try and tell their narrative again, for the 46th time, maybe not with you, but, combined with many, many people, interrupt them and say, no, moratorium on history. We are not going backwards. We are moving forward. None of this goes over well with a favored parent. Most of the time they behave themselves in the office though. All right, so these are the important questions or frameworks to use as a clinician. So you pose it or you frame it as what needs to happen to move forward. Remember, under mild and moderate conditions, the favored parent is the one that is chirping that, oh yes, I want, this rejected parent and this child to have a relationship. Well, you take them up on that, all right? Don't lose track of that. Point that out to them strategically. That you want this relationship. That's what you said. You said that several times. What needs to happen to move forward? What do you, favored parent, need to do to help this move forward? Which again is a healthier relationship with the rejected parent. And what do you need to do or not do that would be best for your kids? That brings it back to that child-centered focus. So it's really hard to argue something that is not in the child's best interest as a favored parent, to sit in with a clinician and argue something that is definitely going to hurt the children or hurt the relationship with the target parent. Parallel versus co-parenting. All right, let me just touch on this a little bit more. So under the co-parenting model, this requires that both parents are willing and able to communicate in a healthy way. And they can do it online, but it generally means that they have the ability to effectively communicate through other mechanisms, text messages, voice to voice, for example. It also requires that both parents are reasonable and flexible with each other. Honestly, there needs to be some flexibility in parenting, especially as children get older and become more self-sufficient and independent and start driving. Past issues, emotional hurts, injuries, wounds, and revenge do not interfere between these parents. They are not focused on using the children as weapons to enact revenge towards the other parent for whatever, they feel that in ways that they were wronged, for example. And these parents work together to ensure the best psychological and physical outcomes for the children, that they are in sync with that. They are on the same page with that. That's what they both want. Their marriage didn't work out. And yes, there were some alienation tactics being used, but co-parents are able to get past that with education and intervention and be on the same page with their children. Parallel parenting, however, it's not ideal. All right. It's not what you aspire to, but in many instances, it's how you start. It's sometimes necessary after a particularly gruesome divorce or modification. For example, sometimes it's just the best way to come out of the gate with some space, for these parents in the ways that they interact with each other. Only the most essential interactions between the parents are required, the most essential, all right, which would be, certain medical, certain, aspects of school, for example. The most essential. Parent A does what he or she wants on his or her time, and parent B does what he or she wants on his or her time. And I'm not talking about, making sure the kids get to school or making sure the kids are healthy. I'm talking about rules, discipline, bedtime, curfew, things like that. And this is hard. It's hard to have to stay in your lane while the other parent is doing things in a very different way than you are. Which again is why parallel parenting is not what you aspire to, but it's sometimes necessary in the beginning. And for everything routine, again, discipline, curfew, bedtime, what kinds of foods they eat, what kinds of snacks they get. You don't have a vote in the other parent's world, and vice versa. You just have to stay in your lane, and that's a challenge. But I do a lot of parallel parenting in the beginning with these high conflict parents. And thirdly, let's talk about the education of both parents, because I think this is an important piece to stress. Toxic stress, trauma, and outcomes are important for these parents to understand. Present them with the science and research. It's available to us. Help them understand that children are resilient up to a point, but they're not resilient when toxic stress is chronic and overwhelming. They will suffer the negative outcomes. Children are not hardwired to reject a parent. That's a concept that I engage in with these parents on a regular basis. None of us were hardwired to reject a parent. I mean, biologically, it's all about survival. And so you have to attach and connect to your primary caregivers in order to ensure your survival. So rejecting a parent is not biologically wired. And then use all of this information that I've been discussing with you as your backdrop. I will refer parents backwards to, okay, let's review the impact on the brain structures of toxic stress and trauma. Let's talk about a smaller corpus callosum. Remember what that meant, when you first learned about it? So I use that as a backdrop. It can be a very powerful backdrop. So what can you expect from the favored parent during reunification work? All right, resistance, yes. Obstruction, yes. Disruptiveness, yes. Let's talk about that. So initially, the favored parent, in my experience, through my anecdotal information, cooperates. They appear to be available, willing to do whatever. Okay, they usually come to me, with court orders, for my involvement. And so they want to demonstrate to the judge that they are playing nice on the playground. Over time, they become resistant to being in the same room with the target parent. Okay, not usually the other direction, but the favored parent becomes resistant to being in the room with the target parent, and you have to deal with that. You have to manage that. All right, unless there is, documented, factual, significant domestic violence, keeping these people in the same room is important. And over time, the favored parent starts to create issues. They start to try and obstruct. They become less available. It's harder to schedule with them. I had one parent who I was involved in email communication with. Both parents are kind of monitoring their email communication. And one parent told, the favored parent told the target parent, well, I'm not available for 3 months, to have an appointment in my office, with me. And so you start to see these things over time, and they start to push back at the clinician. They start to push back at me about being available and about, maybe my office hours, for example. So this is kind of a trajectory that you can see with the favored parent, especially in the moderately alienated situations. So I'm going to focus on the two most common personality disorders that I see in my practice, which is borderline and narcissistic. So this is how a borderline might present, in your reunification work. They talk in circles. Okay, it's difficult to pin them down. They contradict what they just said 3 sentences before. They can be emotionally labile, in your office. They are irrational. Remember, they get stuck in the limbic system, and their access to their frontal lobe and their higher level cognitive skills and analytical logical skills are essentially largely offline. They get stuck on something. It's very hard to move them past something, especially if that something is in the past. They tend to be suspicious and or sometimes quite paranoid sounding about the other parent. One or both attorneys, you behind your back, to other people that they talk to. And then they chronically externalize blame. It's never their fault. It's their attorney's fault, the other attorney's fault, the other parent's fault, professional's fault. Again, my fault when they're talking behind my back. And you're really dealing with a lot of abandonment fears. Okay, this is the person who did not develop a strong attachment, a secure attachment in their own early history. And so losing their children, even part-time, to the other parent is a trigger for their own abandonment issues. What about a narcissism in family work? All right, this is how a narcissist might approach or present to you. They're arrogant. They are emotionally labile, which means their emotions, wax and wane, quite obviously. They lack the ability to take another perspective. And so you just don't even try and, create a way for them to take another perspective, because then you get off track and you get hyper-focused on that. And it's just something that they are not readily able to do. You will see the entitlement during your work. They are entitled, special, and unique, and they don't like it when they are not approached in an entitled way, and they accept no responsibility. It is always somebody else's fault. So one of the things I recommend is mitigating triggers that could derail this family work. So you got to figure out, what are the primary triggers that set people off, especially, the target parent, because the target parent is very vulnerable to the triggers that happen in the marriage or the relationship. Acknowledge the triggers up front for both parents. The favorite parent has triggers too. If their needs aren't met, if they sustain a narcissistic injury, for example. So acknowledge the triggers and then have a plan for them so that they don't derail, the progress. So maybe you can give each parent a trigger word, a buzzword that they use when they're feeling triggered. And then you can, pull back a little bit, get everybody back on track and proceed. For all high conflict personalities, though, we focus on the future. All right. We focus on choices, not insight. Please don't focus on insight with these high conflict personalities. You will quickly find yourself sinking in quicksand. And set expectations for behavior in your office. Okay. There's no name calling. There's no profanity. There's no bowing up. There's no pulling out to the edge of your chair so that you can lean forward and intimidate. Set expectations for behavior. So managing the borderline or the narcissist during family work. Never ask, how do you feel? Ever. Don't ask, how does this make you feel? How did that make you feel? Because that will put them straight into the limbic system, and all they're going to do is feel, and they're not going to think. All right. So you want to stay cognitive with these high conflict personalities. You want to say, what do you think? Not what do you feel? What do you think? And if they start to say, well, I feel really angry, that's what you feel. What do you think about this? What do you think about this topic that we're discussing? What do you think about this solution? All right. And then always remain cognizant that you have to manage abandonment issues in the borderline and entitlement issues in the narcissist. So these are, as I'm ending up here, just some helpful statements that you can make to the favorite parent, along the way, interwoven in the other things that you say. Let them know that you want to help, that you will listen to their side, especially, when they're entitled. Make it known that we all have to follow rules. We're all under a court order. You guys are under a court order, so am I. The court has ordered me under these guidelines to do X, Y, Z. Express, I do understand, when that seems to be relevant. And I'll work with you to make this better. These are all cognitive statements, that you want to present. And then forward progress. All right. Saving face is one of the last concepts that I want to present to you, because this is important when you're working with a high conflict personality. You will get much further with them if you create a way for them to avoid humiliation, avoid embarrassment, provide an out for them that is reasonable and will not, hurt the children or derail your objectives as you're moving forward. Allow them to retain a sense of control, okay? And then allow them to retain dignity, because these are all ways for the favorite parent to save face and then be more involved in the process, because they're not dealing with all of these very intense emotions, humiliation, embarrassment, dignity, etc. Keeps them in their limbic system. How about saving face for the borderline? All right. Create a way to align with the favorite parent on certain issues. Again, it doesn't always have to be no, you're wrong. All right. Don't die on every hill. There's a lot of things in clinical work with these people that you just have to let go, and you just don't address it. And allow the favored parent, when appropriate, to be the expert about something related to the child and give them that feedback. That was a great idea. Wow, I'm really glad you thought of that. You know, goes a long way. Saving face for the narcissist. Create a way for the narcissist to be right. Remember, they're special, unique, and entitled. Don't back a narcissist into a corner. All right, they come out swinging. Create a way for the narcissist to have some control in the situation, and praise the narcissist. Remember, they need lots of adulation. So praise that narcissist. That was a great idea. You managed that very well. I'm really happy to hear that, kind of a thing. And so as a clinician, though, my last concept here is you have to figure out how to manage yourself, because the favored parent is going to present with many antics, disruptiveness, obstructionist, manipulation. And so you as the therapist have to create a way to keep your own emotions in check, all right? Because it's frustrating at many points along the way to deal with these high conflict personalities. Probing questions are risky. Just stay away from them. And confrontations are risky. They will just set you up for failure. So those are some things to be mindful of as a clinician. And my summary thoughts, succinctly, are doing reunification work for mildly or moderately alienated children is more complicated when the favored parent has a high conflict personality disorder or many of the traits. Managing the personality disorder is sometimes difficult and requires a deliberate approach to reunification. You've got to have a plan to manage this difficult parent. We know that toxic stress is a potential outcome for the children of high conflict personality disordered favored parents. Be mindful of that. Create ways for that toxic stress response to reduce in the children. Including the favored parent in reunification for mild or moderately alienated children is important. I hope that I made my points to you. And emphasize forward progress. Stay cognitive. Don't allow them to fall back into the limbic system where everything is emotional and nothing is cognitive. So I thank you very much for your time and hope that you're able to implement some of the ideas and notions that I presented today. Thank you.